welcome. Please come in. Come on. Don't be shy. There we are. So, I'm so excited to have you here. You are the last applicant for our experiment today. So, I'd like to just get started real quick, if you don't mind. Yeah, let me just ask you a few questions, okay? Can I grab your name real quick? Wonderful. And is that the name you prefer to go by? Fantastic. And what's your date of birth? There we go. Okay, and are you experiencing any current pain or illness at all? Wonderful. All right. Anything significant about your medical history? Any sort of chronic conditions? Any hospitalizations? Surgeries? Anything like that? Wonderful. What about your family history? Is there any history of heart disease or cancer, diabetes, any sort of chronic condition of that caliber? Excellent. And any allergies at all? Medications, food, people? All right. And are you currently on any medications at all? Okay. Excellent. So, is there any particular reason that you wanted to join our experiment today, our little study? Run that by me again. Oh. Yeah, no, you were looking for the study with the pills that give you super strength, right? Oh, honey. No. This is the study that we're going to be applying some substances to your ear and see if it makes your brain melt. Oh, nope. You're here now. Yep. Can't back out now. I mean, it's a good kind of melt, right? It's not like, did a little too much acid at Burning Man. It's more like, just kind of like, a little bit. I mean, tongue out, optional or not. I mean, it really doesn't matter. Yeah, I've had the experiment done myself and I'm perfectly normal. You know what I mean? Yeah. All right, well. Yeah, we'll just chalk up that to curiosity then. We'll fudge the details a little bit. So, let me put that down. And let's get you all cleaned up, okay? So I'm going to sanitize my hands first. Getting kind of to the bottom of this little one here. There we are. And just rub that in until it's dry. There we are. Now for our study today, for our experiment, I will need to be touching you. Is that okay with you? Do I have your consent to do that? All right, consent for brain meltage. Can't wait. So, first I want to clean up your ears a little bit, okay? This is just for sanitary purposes. I'm not calling you dirty or nothing. I mean, if you were, it's nothing I can judge, but I'd like to just give you a little once over with some solution. And then we can move on to examining your ears. And then brain meltage. Alright, so I've got some tissue here. that I'm just going to be getting ready there, and I'm going to pop on some gloves, okay? And just like that, magic gloves on. So let's get you all cleaned up. That's a little cool, isn't it? I want to make sure that you are all clean and free of dirt or oil or dust. And that we are getting some clean results. The substance we're going to be using for the brain melting is a little volatile, so we have to be very careful that the area is clean, because it's possible that it might have some unwanted effects. But that's why we have these experiments with wonderful volunteers such as yourself. I'm gonna get another tissue with more cleaning solution. Apologize if my breathing is a touch noisy. Allergies are about in full force once again. On the one hand, I am extraordinarily excited that it's warm enough to have allergies. On the other hand, as I get older, it seems my allergies get a lot worse. Oh yeah, I make it sound like I'm real old. Well, honey, I'm at least 48 years older than you. At least. Yep. Nope, no hyperbole whatsoever. No exaggeration. I just use really good skincare. I think you are all clean and ready to go. So I'm going to put this onto the side. And I'm going to be taking a look at the insides and the outsides of your ears just to make sure there isn't anything wonky going on, okay? So I'm going to start by inspecting the outsides of your ears. I'll do a little bit of just taking a brief inspection. I'll do a little palpation around the ears, and then we'll take a look inside, okay? Alright, you doing okay so far? Comfortable enough? Very good. Please let me know if at any point there's any pain or discomfort. That's very important for us to know, okay? Wonderful. So, let us take a look at this ear. So, I just want to make sure that there aren't any cuts or scrapes or any irritation, any swelling on the ear. Take a look at the back of the ear here. Wonderful. Wonderful. And take a look at the other side. Removing any cuts or any tenderness at all? It feels normal. Excellent. And what if I do a little bit of palpation along the lobe and the helix? How is that all feeling? Okay. Alright, so everything's feeling just normal. Excellent. So let me go ahead and set up my otoscope. I'm going to grab a sterilized speculum here. And just pop down the little tip here, and we're going to take a look at the inside of your ears. So I'm just going to be pulling up and back on the top of the helix so that I can straighten out the ear canal. And then I'm just going to take a little peek inside, okay? Alright, so I'm going to start on this side. Pull up and back. And then very gently insert the otoscope into the ear canal. And I can see if there is any swelling or irritation, or if there's any impaction of cerumen on the tympanic membrane. Just making sure the tympanic membrane is healthy. There we are. Okay, that all looks wonderful. And check the other side. Up and back. And then just very gently insert the otoscope into the ear canal and look around. The ear canal is healthy, the skin is just a touch red, but nothing out of the ordinary. I think overall looks healthy. The tympanic membrane looks nice and pearly gray. There's no perforation, no swelling. So I think we have ourselves some healthy ears. Alright, so since your ears look healthy enough for the auditory activity, I think that I can start getting all my bits together here. So I have our medicated substance here, and I'm just going to start preparing that. So the substance is in a gel form that, when stirred and fluffed up, turns into a foam. So just going to swirl around our substance here. See? It's a nice minty smell. And as we stir, we get a nice foaming consistency as such. And I think that we're going to add just a touch more, as I want to really saturate the ears. Alright, that looks like a much better amount. So the aim of this substance is to help produce sound and chemicals that make your brain feel like it's a nice warm pile of goo, essentially. So, you ready to go? All right, let's start. We're just going to start by covering one ear and applying our substance on the other. How is that feeling so far? Should be a nice bit of tingling with that. There's a touch of menthol in our substance here that gives the skin a cool sensation, while the sound aids in the tingling process. Okay, let me get some for the other side. I'm going to put my hand over that ear and just bring our medicated foam around the ear. How does that feel for you? So, now I'm a little bit foamy, but I'm going to add a little bit more on each side. And then we're going to massage the foam into the ears. Here we are. So, we're just going to dive right in. So I'm going to start with one ear, then the other, then both. Alright? So, let's start here. Just using my fingers to gentle circles in front of the ear, behind the ear. Rubbing the top of the helix down to lobe and trigus. There is quite a bit of foam here. So how are these sounds making you feel currently? Just the one side being manipulated. How are you feeling currently? Okay. When we move to the other side, we're going to try to only have the sounds of the foam and massage, and I won't be speaking at all. See if that has any effect on how you feel. Alright? There we are. So, I'm going to move to the other side. And how was that? Pleasant? Do you think that had any sort of effect on how you felt with or without talking? Did that have any sort of different effect? Okay. So now I'm going to do both ears simultaneously, right? Just start rubbing the front of the ears and circling to the back. And then to the ear itself. We have a little bit of time before our foam starts to dissolve, so we're going to make the most of it. The foam is starting to pill a little bit as all these little textured bits. Which might have a small effect on the sound. It might not. That's what we're trying to experiment on with you. Keep using the foam, keep massaging it in until there's not too much left. As you can see, it's starting to dissolve a bit. Now I don't want you to worry about going home with foamy ears. We will clean you up afterwards. Right, so the foam about dissolved. So we're going to do just a little bit more. Not a lot. Just enough to give us a little more time to really determine if this experimental medicated foam has the properties to induce a brain melting state. It's the fun part about my job is I get to come into the office each day and melt some brains. It's actually my title here, Head Brain Melter. The close second was ear orgasm coordinator, but some of us felt that might be pushing it a little far. Brain melting is a bit of an easier goal to achieve than ear orgasm. Finished with our experiment today with the foam and the massage and gloves. Excellent. Wonderful. So, I am all sticky and covered in white stuff that I don't necessarily want to go out in public with on, so I'm going to change my gloves here. And we're going to use some tissues to wipe off as much of the foam as we can. And then I do have some cotton buds to get into the little nooks and crannies of the structure of your ear. So I'm going to pop on another pair of gloves. Try to do it quickly, but hands are a touch sweaty. I tend to mention that quite often, don't I? I suppose that's something that probably nobody really needs to know, but I've just taken it upon myself to let everybody know regardless. It's one of those useless details about myself that most people who know me know about me. Excellent. So I am going to just start with our dry tissue to wipe off as much of the foam as I can off the ears. So it's turned into more of a sticky, gummy sort of substance. So we're going to do our best to get as much of that off as possible. And then we will use our cleaning solution to wash everything off. Then you won't have to go back out into public with sticky ears. Be a bit of an unpleasant state, I would think. We'll get you all taken care of. So, how do you feel this experiment felt as opposed to the possibility of taking a pill that gave you super strength? I think this might have been a little bit of a better choice. Yeah, you know what, you're right. Super strength would have been awesome, but I got stuck with melting brains. It's not all so bad though. So I'm going to use a cotton bud to just pull out some of that foam in the inner workings of your ear. Very gently pulling that out. Making sure not to get any on the inside of the ear. Volatile substance, remember. Don't want your ear suddenly exploding. Oh no, that's only happened maybe 2 or 3 times. Yeah, we've run this experiment like 4 times. So I find those to be fairly good odds. And for the other side. You're doing really well. Appreciate you sitting so still for me. Makes my job a whole hell of a lot easier. Can you imagine if I tried to do this on somebody who was swaying from left to right? Well, I mean, I can imagine. Where do you think the 2 to 3 instances of ear explosions came from? It's from people just waffling around a bit. So now I'm going to take a cotton bud. I'm going to put some cleaning solution on this and then clean up your ears a little bit. There we are. And just wiping the inside of the ear and making sure to get all the little nooks and crannies. Here we are. Wonderful. Right, this is looking really nice. Here we are. And just swipe that around the ear. Excellent. And let me see if I can wet a tissue and clean more of the ear. You know, to be honest, with the other patients that had issues with ear explosions, I didn't actually have to clean their ears afterwards. So So I would be trying to be extra thorough with you. So I'm going to make sure that I'm doing this correctly, as I haven't had too much practice. Right, let's get another tissue. And hopefully this will be the final cleansing before I dry off. And then we can send you on your way after a short little exit survey. Nope, you don't get a choice in that. You gotta do the exit survey. Alrighty, almost finished. Great, so I am going to just split this tissue and get you all dried off. And then we will do our exit survey and then send you off. I'm very pleased with that. So I would just like to ask you a few questions regarding our experiment today. So firstly, on a scale from 1 to 10, how effective did you find our medicated foaming solution? Did it induce those brain melting tingles pretty well? One's gonna be not at all, no brain meltage whatsoever. 10's gonna be, holy shit, how can I talk right now? Those completely melted my brain. Wonderful. Okay. Excellent. And on a scale from 1 to 10, how relaxed would you say you are right now, with 1 being the least and 10 being the most? Very good. On a scale from 1 to 10, how apt would you be to use this product in the future to induce brain melting tingles? With 1 being not at all, please let me get out of here, and 10 being, I'll take home a whole case today. Wonderful. And on a scale from 1 to 10, how did you find the experiment went for you overall? Whether it was the from start to finish, rather, if it was the setup that we had, or if it was, you know, the process we went through with cleaning your ears and such. How do you feel that entire process went for you? With 1 being absolutely horrific and 10 being there wasn't absolutely anything you would change. Okay. And is there any particular notes you would like to put on record that we could change, that we can improve upon? Okay, yeah, the possible kidnapping was maybe a little much. Yeah, I do agree there. Okay, be more low-key on hostage situation. Yeah, I feel you, fam. I apologize. But, you know, since we lost the other participants due to ear explosion, kind of desperate, you know? So, alrighty. Well, I think that's really all the questions I have for you. Are there any questions that you have for me? Ah, side effects. Okay. So the side effects of this medication is that your ears may feel a little bit dry. It does have a tendency to dry out the skin a little bit, although that also could be due to our cleaning solution as well. We haven't really narrowed that down yet. You may also notice that your brain feels a little bit foggy for a while, and that you feel a little drowsy, a little sleepy. Okay, so some fatigue could be possible. You may notice a little bit of ear burning due to the menthol. So when you go home, I would thoroughly wash your ears and maybe give them a little moisturizer so that they aren't dealing with that dry skin issue. Yeah, if you happen to notice that within the next 24 hours your ears do explode, I want you to give us a call as soon as possible so that we can try our best to fix that, mitigate that. I mean, yeah, I'm not going to give you high hopes on that one, but we still need to know. Yeah, we have to list that as a possible side effect when we do release our medicated foam. Yeah, side effects may include ear explosion. Yeah, you're right. I probably should have gone through all of that at the start of the experiment, shouldn't I have? Oh well. So, alright, if that is everything you have for me, then you are all free to go. So I'd like to thank you so very much for being a part of our experiment today. I hope you have a whale of a day and a good rest of your night, and I hope that your ears don't explode, if you know what I mean. Thanks so much. Bye now. Thank you so much for watching. I really appreciate it. Please like this video if you want to, comment if you'd like to, and subscribe